are back here on the Lynne Hayes Freeland Show. What I probably should have said at the beginning, I've only done this for 40 years, but you live and learn. What I should have said at the beginning was the Black Equity Coalition released a study, Missing Our Shot, COVID-19 Vaccine Equity in Allegheny County Report. The title says it all. The data is in the report. Mark, I'm going to come to you. I think by default it ends up with you. So you released this report. What happens to that? What happens to the information? Does the county respond? Does the state respond? And what happens to the information now?
Sure. I think the report is targeted at a diverse set of audience. So on a monthly basis, we meet with Director Bogan for the Allegheny County Health Department. On a monthly basis, we meet now with Secretary Bean. We had been meeting with Secretary Levine, the PA Secretary of Health, Department of Health. We are working with AHN, we're working with UPMC, we're working with a lot of different, University of Pittsburgh, a lot of different partners. I think the idea is, one, to get this information out, right? That once again, we have this lack of data that's been collected. I think the long term is really trying to focus on getting these institutions to have us or our coalition at the table at the beginning of processes, not in the middle of processes, not when we have to come and say, you missed this, you missed this. We bring an equitable view, right? I'm not expecting everybody from every other community to understand all the needs, all the disparities, everything else that's happening in our community. The way you get around that is by bringing people that have that equitable lens to the table. So our goal is to get this report out, show where the issues are, make some recommendations, put it, to spread it out wide. So we want, maybe our community people won't read it. I hope they do. But we want everybody to read it so that you are aware of what the issues are and we can create a better relationship with the governing bodies, relationship with the health systems. As you mentioned earlier, and I'll end with this, one of the biggest issues I think that we've had from a public health issue is just transparency. It creates that hesitancy. It creates going back decades with all the issues that we've had in the medical system. We need to figure out how do we create better relationships and become integrated with all these different systems so there's an equitable lens that's brought to the table.
So Tiffany, it's for me, I'm listening to this conversation, and I know that one of the things that often happens in the media, and I because that's my life, I'll use that as the example. A lot of times people come to you in the middle of February and say, it's Black History Month. Who can we have for Black History Month? And it's like, well, when you all planned this, why didn't you ask me? Why didn't you include me in the planning? Because now you're asking me to fix it. Yeah. And so I'm feeling similarities there.
Yeah, I mean, we've been in that position, I think, this whole time, from the testing data now to the vaccine distribution. So now we're at a point in time, we have the recommendations. It's now time for the stakeholders to think about their resources and their distribution and do something differently. We have, at least in the past month or past couple of months, had more community vaccine distribution events, bringing the vaccine to the communities, to the people, versus expecting them to come to, some site. As the Black Equity Coalition, we hope to partner with the stakeholders that Mark mentioned to do more of that. We really want to go into communities, partner more with churches, and have, pop-up clinics, if you say, in places that are accessible for people. So that is our plan for vaccine distribution, but also mentioning that we aren't just thinking about vaccine distribution, we're thinking beyond that. And so that our coalition needs to, constantly be working on the inequities that are in our community, whether they're related to health or jobs or education or so forth, that we will have work to do even after everyone has a vaccine. We have a lot of work to do to make sure that everyone gets the vaccine, but we have a lot of work beyond that as well.
Well, and I was going to, Lisa, bringing you back into to this, because I mean, the realities are we got to look at the lessons learned from this data, because whether or not it is booster shots going forward or heaven forbid, another pandemic. But I mean, all of those things are now within the realm of possibility. Right. So if we don't use this information, if we don't use this data, then nothing changes.
Yeah, and there probably will be something else in the future, and we should be prepared for it. There's going to be some kind of health crisis coming along. And my data friends talk about building a good data infrastructure. And the things that we asked for in this report should go to build that infrastructure so that you can, like kind of pivot that from the pandemic that we're dealing with now to the next health crisis that comes along, or even use ways to apply it back to some of the chronic things that are affecting our communities now, so that we can be more data informed in how we approach those things, and our policymakers and healthcare providers have the appropriate data that they need. Because the adage goes that you plan it, you do it, you check it, and you take action on that. So all healthcare providers, all healthcare institutions should be reviewing when they do these things. Mm-hmm. They should be reviewing what was the outcome and how much, what success they had with the vaccine events that they planned, and looking at the numbers that, we can provide them. And absolutely, then right. Taking action based on that to make sure that they're reaching where they need to reach.
Well, I'll tell you what, your data shows that we have a lot of work to do, but we are grateful. We're grateful that you guys did the heavy lifting. And so now it's our job to keep a spotlight on it. Thanks so much for joining us today. Great information. And, you got a standing invitation. Come back anytime you want. I'll be back in a second to wrap all this up. Don't go away.
Thank you.